Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stuckey. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, everyone, thank you for tuning in. Welcome to another episode. Today I'm with Dr. Imran Ahson. He's an oral and maxillofacial surgeon practicing in Massachusetts. He is a faculty member of Tufts University and the co-founder of Mass OMS. Imran, thank you for joining us today.
Thank you so much, Grant. I'm actually a listener and a big fan. The only caveat to this is that I usually listen to you on 2 speeds. So like when you're talking, I'm like, speed it up. But yeah, so if I'm talking fast, then my apologies. But honestly, it's just such an honor to be on this podcast, especially in the OMFS community. I really appreciate everything that you're doing.
Oh yeah, thank you. Appreciate you taking the time to do this as well. So could we start by just having you give us a brief history of your training and your current practice setup?
Sure. So I born and raised in Florida. I'm a dual degree from the University of Florida. I did a fellowship in craniofacial surgery, but most recently, like you said, I'm a faculty member of Tufts University. I helped co-found one of the largest private practice groups in the New England area. But what my goal for today's podcast, and honestly, anytime I go on a lecture or a podcast or some sort of space where I have the ability to talk to people, is to connect oral health and systemic health. I think this is something that we as a specialty are really the best suited to do this. And right now, it's the most important time to do this. There's new research coming out. I want the OMFS community to know about it and to be proselytizing the same way that I am and truly believing this stuff, because I think that we're going to be entering into a golden age of not only our specialty, but just of oral health in general. There's going to be a renewed focus on it. And I want you guys who are out there listening to understand the evidence basis and the research links that connect oral health and systemic health.
Nice. Yeah, that's fantastic. So where would you start us off on this topic? You know, what's the best place to start?
Yeah, well, let's focus on what I think recently has come out. The most recent evidence of why I think that we need to be really out there talking to everybody about this is that there's now been research coming out of the scientific literature, not from our literature, but from the physicians and cardiology literature, saying that heart attacks should now be treated as an infectious disease process. And that infectious disease process usually stems from oral cavity bacteria. So they've done specific cultures of atherosclerotic plaques and have found that oral bacteria are present in a majority of these plaques, which leads to the idea of seeding and inflammation causing these things to constrict our coronary arteries. And as I'm sure many of you guys know, that's the #1 killer still in the United States. So I think perio has done a great job of making a correlation between these, but now finally, after so long, we have this causal link. And I feel like, there's so many correlations of other systemic disease processes, but I think that we should start with that one because it's the lowest hanging fruit. And it is in a climate of focus on prevention and other preventative avenues for addressing these kind of really significant pathologies. And, cardiology is one of them, and heart disease is one of them. We can also talk about the neurocognitive benefits of making sure that your oral health is kept up to par. We can also talk about your nutritional benefits. I think that there's so many things that we can talk about. Like the focus that I want to talk about is the overall oral health. But those specific topics of pathologies and linking them to diseases that we treat every day is what I'd like to talk about in today's oral surgery podcast.
Nice. Yeah, that's fantastic. Like you said, I mentioned the heart attacks, and it's interesting to make that shift. I mean, I think we've been, as dental practitioners, have been thinking about it kind of as an infectious disease and knowing the seeding of bacteria from the mouth to the heart. But I mean, the vast majority of patients don't have any clue about that. They think heart attack is probably just a bad diet. You're eating too many hot dogs and French fries or whatever. But I mean, how do you go about, I guess, talking to your patients about this or helping them understand this?
Well, I think that when patients come to see us, I think that they are often coming from the perspective of infection. Infection is and pain is their number one reason for seeking out our care. And we're talking about everyday oral surgery, right? Like that's the podcast name, and that's the oral surgeon's main job is to have somebody come in with pain, with infection, and we help treat that pain and infection. Now, obviously, there's linkages to other things that we talked about, but the patient's perspective, their number one goal is to put out that fire of infection, put out that fire of pain. And I think what our job is to link all of these things to systemic health issues. And the other issue that people come in to see us for is to regain some sort of function. When people come in for, let's say, a full arch treatment where we remove all of their teeth, replace them with dental implants, give them the opportunity to chew again. Their main goal, their perspective of it is they have the ability to smile again, they have the ability to chew again. But what are the downstream effects of that? And you probably see it in your practice every day. I certainly see it. And now we have the evidence and literature to show us that if you restore somebody's ability to chew with dental implants, it leads to increases in their nutritional status. It leads to decreases in their cholesterol, hypertension, all of these things that we look at as a luxury for dental implants, but all of these things that we know have systemic effects like cardiovascular status, like nutritional status. And that's where I kind of start out with. I find out what their initial problem is. And I say, hey, listen, this is going to lead to problems down the road. This is going to lead to issues with your heart. This is going to lead to issues with your nutritional status. Even your overall quality of life is going to be affected. I'm very blessed to work at Tufts University, where we have this mentality of building the global leaders of oral health. And one of those leaders in the perio department is a doctor by the name of Dr. Yu, and she recently published another paper that I would really recommend that you guys look at. It was published in the Lancet, and she connected the number of teeth, the overall number of teeth, and things like all-cause mortality, other systemic health conditions. And she looked at the number of teeth from 20 to 29, from 19 to 10, and from 0 to none. She found that as you decrease those numbers of teeth, the overall rate of mortality increases. You have worsening systemic health outcomes. And those are, again, correlations, right? We can't really say that this is something that is causal, but we should start the conversation, right? We should find those causal links in the same way that we're now looking at the heart attack being an infectious process that could be seeded by the mouth. Those causal links, I think, are out there, and it's up to us as researchers and scientists and surgeons to go out there and find those answers.
Yeah, very good point. So where else would you take us with this? I mean, maybe you could touch on neurocognitive as well, because I know that's a big thing lately that's kind of being discussed on many podcasts and scientific fronts of diet and neurocognitive benefits. But how do you link the mouth?
Yeah, I love that, because I think that there's two neurocognitive issues that I want oral and maxillofacial surgeons to know about. Number one is this correlation between poor oral health and Alzheimer's, which is something that more and more information is coming out. I think it's only a matter of time before we find that causal relationship. People have identified gingipains and other Alzheimer's related proteins that are connected to the oral health and the bacterial load and inflammation that is occurring in your mouth. But then that's a very specific subset of humanity, right? People who are either trending in this direction or want to prevent that for themselves. What I would say is the neurocognitive effect that I focus on every day is just the ability to chew. Chewing is something that promotes hippocampal growth. It's something that if you restore somebody's ability to chew, they start scoring better on cognitive tests. They start, having the ability to have hippocampal growth. The hippocampal growth has been identified in mice, which is like upwards of 20% change of pre-chewing versus post-chewing. But this is something that also has been documented in clinical research at the human level as well on cognitive tests, on things like that for people who are in their older ages. You have an edentulous person preoperatively, and then you give them the ability to chew with implants or with dentures or some sort of prosthetic treatment, and then that increases their cognition. Why is that happening? I don't know why that's happening. We just know that it's happening. And so this is a very significant area of research that I focus on because I gain benefit from it. When entering into a really difficult surgery, you'll find me chewing gum. I think lots of people are in surgery are looking for like that next sort of like performance enhancement. And chewing gum to me, I think is undersold. It's something that, I think that in the 1950s, a lot more people were chewing gum. It was standard practice to have gum or some ability to chew as the way to pass the time in World War II. It became one of the standard rations for GIs that were out in the field. They would have chocolate, cigarettes, and gum. And this thing is something that keeps you awake. It keeps you focused. So I do that in my own practice. Like when I really have to focus. Before today's podcast, I was chewing gum to get those neurons firing so I could make sure that I could say something very eloquent to you today. And that ability to chew is something that I think we don't really know enough about. We have all of the clues there, right? Like if you look at the somatosensory map of our brain, our mouth is such a large portion in comparison to all of the other portions of our mouth. It's something that's so visceral, right? Like I have a young daughter, she's 5 months old, and she's putting everything in her mouth. And she's learning through the oral environment of what everything is. And she doesn't really understand how to use her arms very well. She doesn't understand how to use her neck very well, but she understands how to use her mouth very well. And it's something that's so primal, and I feel like we undersell it. And especially oral and maxillofacial surgeons, I think we need to be on our soapbox and telling people about it. We see the end results of this stuff. We see people that are not taking care of themselves, that are not addressing these problems, and we see them in the hospital with infections and osteomyelitis and all of these issues that you and I both know that they could treat if they were getting proper preventative care. I think there's another component to health that is optimal health. It's not performance enhancement, but it's me feeling like the best version of myself, right? And that's something that I think that we should also focus on as oral and maxillofacial surgeons. I think that the idea of like the performance enhancement is this dirty word that people are looking at it as an arms race to get ahead. But I like feeling good. I like the ability to speak eloquently after I've chewed gum, after I've had a healthy mouth for a long time. All of those things are things that I want to have in my own life, and I think that's something that we should be talking about.
Oh yeah, for sure. I've mentioned on the podcast before my story of chronic back pain, and I had some failed back surgeries and just horrible pain for many years, and about to do another back surgery. And I read an anti-inflammatory diet book and started this diet basically free of sugar, free of processed foods, no real bread, kind of keto type stuff. But within just a couple months of starting this diet, all my back and leg pain went away. I mean, it felt so much better cognitively, so many benefits that even just telling my neurosurgeon who was about to do my surgery about it, I mean, he was kind of laughing. He's like, there's no way a diet's going to take away your pain, But I think just in general, even the specialists and people who should know things about this don't know a lot about diet, and especially not oral health and how it affects the rest of your body. I mean, what other things would you touch on that are probably unknown from oral health to the systemic health?
Well, I'm so glad you brought up inflammation, because inflammation is this albatross that I think is hanging on around the neck of so many people in this country. And whether it's systemic inflammation like you've experienced that has contributed to your back disease versus systemic inflammation that's contributing to diabetes, Alzheimer's, cardiovascular disease, all of these are different downstream effects of this overactive inflammatory process. And that is something that we know that benefits from good oral health. And again, a lot of this is coming out of the perio literature that you treat somebody's oral health and their systemic inflammatory mediators go down. But again, even in chewing, right, you change your diet and your inflammatory mediators go down, as you've experienced firsthand. The idea of chewing a better diet contributing to less inflammation, I think is something that we're just taking baby steps in the medical community right now. Inflammatory mediators like interleukin 6 or, a lot of these other ones that are out there have been shown through diet modification to decrease after a proper regimen, like maybe something anti-inflammatory like you're talking about, or having a more focused diet with your gastroenterologist or nutritionist that you can decrease those levels. But my point is that I think that the inflammatory cascade is something that we really have a lot of control over when we come to practitioners of the oral cavity. I think that it's the first introduction to the inflammatory process. It's the most profound inflammatory process because all of this extra environmental stuff is coming into our body. So you need to have those inflammatory mediators that are preventing the onslaught of all of these different things that could be potentially harmful to us. But it's overactive in today's society. And we see a lot of these lifestyle modifications that have an effect now, whereas nobody was focusing on that. Your neurosurgeon was not focusing on that. And I think that that's a profound shift that's happening not only in our field, but also in healthcare at large, is this idea of lifestyle modification to optimize health, not only from a perspective of decreasing disease, but also making us feel better, look better, and just have overall better quality of life. The World Health Organization qualifies health as an overall state of well-being. So that's mental health. That's the way that we feel every day. That's getting up out of the morning and not feeling like you got hit by a ton of bricks. All of those things are things that we have a certain amount of responsibility over and a certain amount of agency over. And now people are looking at that, I think, in a very different light. And so I'm really glad that you brought up your own experience with it because, I've done it too. Like over the past year, I've been on my own health journey. I've dropped 20 pounds. I've dropped 10% body fat. And just like the most basic stuff, like we were coming home from a trip this past Labor Day weekend. Everybody was traveling this last Labor Day weekend. And, I have two girls. We have a ton of luggage, and the ability to like have the stamina to pick up luggage and like go, like you're running a little bit late because your kids are crying and stuff like that. That is something that I had this trip that I noticed that was significantly different from me a year ago, right? And that comes from diet and exercise. The majority of today's diseases that we're treating in our healthcare system, they say half of them are contributed by diet and exercise or lifestyle choices, right? And so I would encourage everyone to start looking into that stuff, start incorporating it in your own life, just like you have, but specifically in regards to the oral health. I remember a podcast you did a while ago. It was with a surgeon that was out of Detroit, and about how there's like a difference between how male members of society have like less wisdom teeth removal and just overall poor oral health than women. And those are the kind of things that, like, if we can move the needle on, we're going to have much more profound impact than the one jaw fracture that we do. I wouldn't say much more profound. I would say equally as profound of an impact as like that one patient that we're able to treat. But if we're out there and we're changing people's hearts and minds, I really think that broad-based mind shift is really going to produce a lot of dividends, not only for our society, but also specifically for us as oral and maxillofacial surgeons.
Oh yeah, for sure. Yeah. This reminds me of, like just repetitive conversations I'll have with my patients, because I think most of us will, like, for example, let's say a patient's missing tooth number 30, and so we have a typical discussion about an implant and, how it's beneficial to your chewing in your teeth. Usually we bring up the fact that it can kind of balance your bite out and it helps you chew. It's all related to your teeth, right, in your mouth, and how this is going to be good to replace that tooth. It stops the domino effect. So, because when 30 is gone, probably 29 and 28 are more likely to crack over time because they're taking more stress. And so we're having all these conversations, but I think rarely do we say how this will affect your systemic health, because a lot of people will say, oh, I don't want an implant because you can't see it, right? And number 30, you won't see it at all. So forget it. It's expensive. But, what other things do you bring up in those situations that maybe could help a patient understand that replacing important teeth, especially chewing teeth, can affect your overall health?
Yeah, I mean, I do a lot of full arch surgery, and let's just talk a little bit about like that demographic, right? It's usually people who are in their 50s or 60s, not taking care of their health, not taking care of their oral health, and they will come to see me, and these are, I'm sure you hear it all the time, like a 65-year-old, even for like a one single implant in the area of like number 19 or 30, will say, I'm 65, like, yeah, like what value am I going to get out of this? Like, I'm basically like 1 foot in the grave. And I'm like, what are you talking about? You have 20 more years of chewing left. Like, why would you shortchange yourself in not choosing this option? And so the paper that I highlight to them is something that is of particular interest to me, which is longevity. And if you have a patient who is a dentulous versus someone who is not a dentulous, and partial edentulous is part of this as well. Like I was telling you, my friend Dr. Yu, who compared the number of teeth going down and all-cause mortality going up. But you're shaving years off your life, and you're shaving quality of life off of yourself. And I'm so thankful that I have the ability to do a lot of orthognathic surgery and to do a lot of full arch surgery, because I see these patients regularly. And I'm sure that you have seen also the difference pre and post is so significant, and we're talking about like 60-year-old women who have been in dentures for their entire life, and you give them the ability to chew again. They come in, they have a renewed zest for life. They have this overall health that I can't really quantify, but now we can actually quantify. There's research out there, and it's not coming from us, Grant. And that's one of the things. If there's one thing that I want to say to everybody that's in the OMFS community, is that we should be doing this research. I find in the literature that it's extremely focused on marginal gains, right? Which is the idea of, if I do this modification of an orthognathic surgery cut versus that modification, what are the differences in outcomes? And a lot of that is because of the literature environment in general. It's very difficult to make a lot of these really grand ideas into a study and get some firm data on that. But my point is that we as oral and maxillofacial surgeons need to be looking at this stuff in our literature, because it's coming out of other literatures. I can tell you the Journal of Clinical Nutrition, a lot of the GI stuff that you had talked about there's a really profound paper that came out of Gut Microbe, which is basically saying that your whole microbiota in your gut changes after you gain the ability to chew again. All of these things are things that like we kind of know, based on clinical experience. Like, we see people that are changing after our intervention. But my goal is, number one, to know that there's stuff out there that is evidence-based, but also to promote more evidence. If there's anybody listening to this that wants to do studies, I'm available. We can talk about that kind of stuff and help you in whatever way possible. We have a lot of resources at Tufts, but most importantly is that I think that we need to start thinking about this stuff more so than we have in the past. And the coming back to your initial question of like, when we're talking to a patient, when that patient is sitting in the chair and I'm talking to them about the outcomes, a lot of what I'm talking about, specifically with the demographic of 50 to 60-year-olds that have experienced a lot of failed dentistry or dental neglect, I tell them about longevity, and I talk to them about quality of life. And I say, listen, you're shaving years off your life. We know this from the evidence, and this is something that I'm personally invested in. This is the papers that I'm currently researching. And your quality of life is going to be so much different. When you talk to a lot of 6-year-olds, they have a renewed interest in their own health. Like, they're going to the gym and stuff. Like, they're trying to eat healthy. There's like, I always say that 60 is like the new 40. You see people like Tom Cruise. I mean, look at how amazing this guy looks in Mission Impossible. He looks so young. He looks better than I do. And that is the standard bearer for 60-year-olds these days. Brad Pitt, Tom Cruise, all these people that are in age demographic that they traditionally, like in the 1960s, would look much more different. And that's what people's standard is now. And I tell them, listen, if you want to have a great diet, if you want to be able to function in the same way that you did when you were 30 years old, 40 years old, you have to do this. And I think that people see that. I think that people recognize that. I think that the word is out about restoring function, specifically with dental implants. The most recent Super Bowl, there was actually a dental implant commercial that came out. So I think that the culture is shifting. I don't have to convince my patients as much anymore. It might be different in Colorado, but here up in New England, people are telling me that they want dental implants, that they want the ability to restore function. People are seeking out orthodontic surgery at all-time highs. Young kids are seeking out orthodontics at all-time highs. So I think that this information is getting out there, and we need to be at the forefront of it.
Oh, for sure. Yeah. And that's a good point you bring up about being more active in the way we can help with research, looking for links in our own practices, and just being more proactive. I think there's good research that's kind of brings up the fact that pregnancy, can be affected by gum disease and birth complications. And I mean, I was just thinking the other day, like, what if we could get the word out on stuff like that? Because I mean, how many people who get pregnant know how critical it is to floss and brush your teeth and have good oral hygiene, and that can actually affect potentially premature birth and all these complications. If mothers knew that, I think they would be, probably much more motivated to do oral health. Any other things like that come to mind that have that link between oral health and certain diseases?
Yeah, absolutely. I'm so glad that you brought up pregnancy and really just like the time around someone's first few years, because I think that is low-hanging fruit for us as oral and maxillofacial surgeons to talk to people about. Number one, breastfeeding, right? There's a renewed focus on that. And I was thankful to go to a craniofacial fellowship where we had a huge focus on breastfeeding. Pat Ricaldi out of Tampa is, I think, one of the best surgeons that I've ever come across. And I was so thankful to work underneath her. And she was such a huge proponent of breastfeeding, to the point where we basically had a pager for frenectomies. I was the guy that would go to Tampa General Hospital at whatever time of night and cut these little babies' tongues to help them breastfeed. And there was a very, very clear indication for when to do a frenectomy and when not to do a frenectomy. And it was such a profound experience to the mother of when they were not able to breastfeed because of the tongue tie and when they weren't. And it was an immediate difference, right? Like the latching was completely different over the course of a few seconds. And so mothers understand that after the birth. I think that we need to get out there and talk to them preoperatively about making sure that their oral hygiene is up to par. There is a significant number of studies out there that connect it between low birth weight and some other issues. But I think the lowest hanging fruit for us is those first few years of life, because everything is through the oral cavity. Everything is through the oral cavity, right? Breastfeeding, how we interact with our environment, speaking for the first few things. And coming from a cleft lip and palate background, you take away the ability for a kid to do that, and you see terrible health outcomes for them. In the third world, where I do a lot of cleft surgery, I go to medical mission trips on a regular basis. It's not a death sentence, but it's a hard battle for these kids if you don't get treated appropriately, and so those first few years of life, I think the development is something that we should really be focusing on, especially in the oral and maxillofacial surgery community that has gone into fellowships through cleft and craniofacial surgery. It's such a difficult route, and you really have to be 100% all in if you're being a cleft and craniofacial surgeon. So I feel like it's a lot to ask of somebody that's in that position to also do research out there and on development and growth and all this stuff. But I think that we're in prime position for that. The other things that I want to highlight when it comes to development is just the idea of the oral microbiota being something that we can control. The kids' first few years of life, especially things like breastfeeding, baby-led weaning. These are not only developing the ability to chew, but the microbiota that kid will have for a very long time. There's already profound evidence that shows that the oral microbiota is significantly different for someone who has a C-section versus someone who has a vaginal birth. The number of oral microbiomes bacteria are much more similar to vaginal flora, and they're a lot healthier in the people who have a vaginal birth as opposed to somebody who has a C-section. That's colonized by skin. It's colonized by all of the other microbiota that's found in like the GI tract. Those are not supposed to be there, and it changes over time. You give a kid enough time, and eventually it'll normalize itself out. But we don't understand. We don't know right now what the long-term health outcomes are between the difference between a microbiota that is coming from somebody who has a C-section versus somebody who has a vaginal birth. And that affects your nutrition. It affects inflammation, like we had talked about. You've experienced a difference when you changed up your diet. Some of that was due to the actual macromolecules that you were getting causing the inflammation. Some of it also, if you were to talk to any gastroenterologist, is due to the microbiota that is colonized inside your GI tract. And so that's something that I think that is also low-hanging fruit for research right now. But that's something that I think that really needs to be looked at. The other thing that everybody, I feel like in the oral health community is talking about is just the idea that our jaws are getting smaller, right? The progress of human civilization has created this environment that is contributing to decreased arch length and inherently wisdom teeth surgery, right? That's something that is the number one most common surgery is oral surgery, removing your wisdom teeth. And so, we know that that's happening on a more frequent basis, but we also know that it's contributing to a whole host of other oral health outcomes. If you were to look at a skull from someone who is pre-agricultural society, they have perfectly straight teeth, they have enough arch length for all of their third molars to be present, very little cavities present. So, there's an orthodontist and a population biologist that wrote a book a few decades ago called Jaws. It's like a hidden pandemic, and I would really recommend that all of you guys read it. And basically, they made the hypothesis that this is happening from a number of different reasons. It's soft food that we're taking in, living indoors, leading to a lot of allergies that lead us to exclusively mouth breathe, the ability for us to have our mouths closed for long periods of time has now shifted. Now a lot of just by behaviorally, because of either decreased ability to breathe through your nose or a number of different factors, our kids are walking around with their jaws open and not stimulating the same kind of growth that cavemen did. And it's leading to what we call devolution, so a disvolution, right? So evolution is leading to something that increases our fitness, our ability to promote offspring. This is the opposite effect. We're getting sicker as a society because of societal choices that we have made. And that's something that I think that I want everybody to know about also. It's something that I talk with all of my wisdom teeth patients about, is that, just because, like the majority of the population, you just don't have enough room in your jaws for your wisdom teeth. And someone will, very infrequently, but sometimes someone will ask me, well, why is that? And I'll tell them, well, it's a lot of it has to do with the first world diet. If you were to look at hunter-gatherer societies that are present on Earth today, if you go to sub-Saharan Africa, into these untouched tribes in Brazil that have really no concept of modern diet or modern lifestyle, they have much more arch length. They have the very straight teeth, very few cavities. And that's something that we're losing as a society. It's something that lots of people have written about, and it's something that is very difficult to prove, but it's something that's out there. That has permeated the national consciousness, And I think that it's being promoted by people like orthodontists. It's being promoted by people like biological anthropologists. But we should be also promoting this stuff, right? We are the ones who have to take care of those downstream effects of that. And I would be very hesitant to say that, wisdom teeth surgery is going away. It's something that, if anything, is becoming more frequent. But it would be great if we could decrease that rate and actually have enough arch length, to have enough ability for us to chew with our wisdom teeth. I just don't see that happening. It's too big of a lift for just one generation. I think this is something that we need to talk about more. I think this is something that needs to have a friendship, and maybe future generations will be able to address this.
Yeah, I'm so glad you brought that up. What a great discussion to have with your patients and talk about. I'm always surprised with how much patients kind of open up and reach out and want to hear, even from me as a specialist of the mouth. I'll still almost every day get a patient say things like, well, what can I do, to make sure this implant lasts well? Or, I mean, have you ever had a patient sit in your chair and maybe they had a broken, busted off tooth or teeth, and they say, what happened? What, is there something I did? And and you kind of are at the precipice of, should I get into this? Like, how much should I get into?
Yeah.
Your systemic health and your diet and all these things that I've personally experienced. And I'm hesitant, right, as an oral maxillofacial surgeon, because I kind of feel like I need to stay in my lane of just the mouth and teeth and say, well, you should floss and brush better. But I'm always surprised when I do get into diet and, even just eating less sugar and limiting added sugar in your foods. People listen and they make changes. And so I think there's more power in what we can say and do than we think. And we're kind of sometimes hesitant to share what we know. Any thoughts on that one?
I think it's just such a function of the healthcare system that we're in, like the idea of production is in everybody's mind right now. I have to slam in as many patients as possible. I have to do as many lucrative surgeries as possible. And I think that is something, you know, it's that's going to be a very difficult road for us to fix. I only have so much time for a patient, and I have to rattle off all of the risks and complications because otherwise I'm putting myself at legal risk. I have to rattle off all of the pre and post-op stuff. So, there's lots of ways to increase your efficiency of delegating that stuff to your staff, and you kind of taking on the heavy lifting of having a conversation just like we're having now. And that's my personal favorite way of bringing this stuff up, is delegating the majority of the stuff to staff or videos. Amos has great videos that go over all of like the risks and complications. And when I'm sitting there, we're having a conversation, I'm trying to suss out what is important to this guy and how receptive they are, right? Like some people, they're just not even interested in talking about anything, right? Like they just want to get the cost for the procedure and get it done and move out the door. But then, just like you said, there are a lot of people out there that are very receptive. And I think that especially now, it's almost that they really are expecting some sort of really guided advice from someone wearing a white coat. This is something that they've seen in the culture now of people who pursue this field as empathic teachers that are there to help you. There's lots of people out there that come to me and say, well, why did this happen? And then I think that's your opportunity to have a few really fast little snippets of information. Like you don't need to go into the whole literature article that I had talked about the difference in teeth numbers. But what you can say is, hey, listen, you're shaving years off your life. Your quality of life is going to decrease. Eating is one of the few things that we can enjoy when we're in our 80s that we couldn't enjoy when, we can't enjoy running anymore. We can't enjoy, swimming anymore in the same way, but you can enjoy that meal. And that's what I want for you. And looking at it as advocacy, I think is really something that has really benefited me in my practice. I think that if you do that more often, it does lead to not only better informed patients, but better outcomes for sure. And I think that coming back full circle to my initial hypothesis, which is that all of this is due to financial incentives, I think that does lead to better finances for all of us. Because at the end of the day, this is a job for us. This is something that we're doing to provide for our families and ourselves. And so I do think that the better of a advocate that you are for your patients, there is a certain amount of karmic reward from that financially.
Yeah, totally agree. Yeah. One other question or topic to touch on. I know there's been some literature showing cancers being linked to gum disease. And of course, we know oral cancers are more likely if you smoke and drink. And so clearly things you're putting into your mouth can cause cancer. But any other things you bring up or topics around that? This is probably, more listened to or worried about by older patients who are getting cancer, and sometimes we'll have that discussion. But anything on the topic of oral health and cancer?
Yeah, The whole HPV epidemic that is present in our society right now, I think is something that we've actually done a very good job, I think, of linking that, getting the information out there. I trained at a big head and neck cancer center, and my attendings were definitely out there on the news telling people about HPV. I think it was something, especially when Gardasil came out, like there was almost like this concomitant marketing program from the pharmaceutical industry, as well as this increase in actual cases, right? Like the number of head and neck cancer cases is increasing on a regular basis because of things like HPV. And so I think that that's something that there's a causal link from poor oral health, not just things that we eat and inflammation and stuff like that, but actual poor oral health from HPV and cancer. I think that what you're also kind of asking is, like, does cancer affect the other way around, or are there benefits for preventing of cancer for excellent oral health? And that's something that I think comes back to the inflammation topic, which is that in general, inflammation is something that we are, as a society, working to really wrap our heads around. We know that it causes an increase in the rates of cancer. We know that over time, if you have your inflammatory process like going out of control, that can lead to other certain types of cancer. I don't know if there's any sort of causal links out there right now, but what I can tell you is that seems to make sense to me. It seems like there's a lot of correlation there, and we should actually search for causation. And if there's anybody out there who is a head and neck cancer surgeon who has a little bit more information, I would recommend that they spread that word out there, because it's not something that's come across my own personal research. But I do think that the idea of cancer is something that's multifactorial, and it's very rare to get the same kind of smoking gun causal relationships like smoking or HPV. But we have those in our own field. Those are two big things that I think that we should be on the forefront of. And I can tell you that patients really appreciate you advocating for their health in those two realms. I don't really talk a lot about HPV because I'm not a head and neck cancer surgeon, but what I can tell you is that I talk about smoking all the time with my patients, because number one, I used to be a former smoker myself. I smoked for 10 years. I used to love the act of smoking, and it took a lot for me to quit. I tried the patches, I tried everything, I tried Chantix, but it wasn't until dental school when I saw it affecting my own personal oral health, and I was like, I don't want to have terrible teeth going on. And so something changed in me that made it worth it for me. But what I can also tell you is that it negatively affects implants, right? That's something that even though the patient is smoking a pack a day, you're going to be held responsible for it. Like, what did you do that messed up my implants? And they could be actually coming in from the parking lot with a cigarette in their hand and still blame you as a surgeon. So just to improve my own outcomes, I'm very much a proponent of talking to patients about ending their tobacco habits. We have a hypnotist that we send a bunch of people. That's what personally worked for me, which is hypnosis. And so that's something that worked for me, and I recommend it to all my patients. Especially those who are undergoing full arch surgery, but even for like orthognathics, right? I have a patient that he is 30 years old, smoking a pack a day, and he wants to undergo orthognathic surgery because he's got a ton of vertical maxillary excess. And I know the amount of impaction that I'm going to have to do on this guy. And so I said, listen, I'm willing to do this with you. I'm willing to go on this journey with you, but you're 30 years old and you're smoking a pack a day. Like, you need to quit this today. And lo and behold, he's now not smoking anymore. He wants the surgery so bad. He wants to look so good that he's willing to turn his life around from that. And so that is something, from an oral health perspective, to come back to your initial topic, is that's something that obviously affects us in such a way that causes cancer. The thing about these other kind of gray areas that we're just taking our baby steps in, inflammation, endotoxins from bacteria, those things eventually causing cancer. I don't think that we're quite there yet, but there's just so much low-hanging fruit. There's so much stuff that's still out there. There's still such a significant portion of our population that is smoking cigarettes. And I would say that those types of people are the people that are going to seek out an oral and maxillofacial surgeon's care, right? Those people end up with no teeth. Those people end up with tons of periodontal disease to the point where, they're just floating in their mouths. And those are also people that they'll have the worst infections that end up in the hospital. Those are also the people that, end up with head and neck cancer. So I think that we really need to talk about those things as well. And I'm such a huge fan. You had another podcast where you said, or where you were talking with another oral and maxillofacial surgeon, where like oral and maxillofacial surgeons are just inherent leaders, right? Like we run a team, we run an OR, and I think we need to be leaders in the community. I think that we need to get out there and use social media, not to just promote the implant techniques that we're doing, not to just promote the before and afters of orthognathic surgery, not to show how awesome it is to raise a fibula free flap. I think that we need to go out there and change the hearts and minds of people who have no concept of any of those things, and not just preach to the choir, but preach to the general public about why these things are so important.
I love that. Yeah, I totally agree. Most of us are natural leaders, and it's good to hear you say that. I think it's inspiring for a lot of us. I mean, I really appreciate you bringing this topic to the forefront of our minds. I think it's super important. We're probably just touching on the tip of the iceberg here, but the goal is to get our listeners thinking about this, researching it on their own, talking about it more with their colleagues, with their patients. And this is all really good stuff. And hopefully we continue to progress in the realm of knowing more of research to be able to educate our patients. So thank you for running through that. Any last minute thoughts you had?
Yeah, listen, it's a collaborative effort. And if there's anybody out there that's doing this kind of stuff, I'd love to work with you. So my email is imran.ahson@tufts.edu. And, I'm doing my own personal research and showing the difference between the ability to chew and not the ability to chew. But anybody out there that's listening to this and feels inspired, that's doing research, let's collaborate, let's get the message out, and let's change people's hearts and minds.
Sure. I can't let you go without ending with some rapid fire questions here. So
I was ready. Yeah, I'm ready.
First one is, what's the best book you've read in the past year?
Yeah, that's a good one. So I'm very much a reader. I would say that the best book that I read, I could not put it down, was Teeth by Mary Otto. She's a writer for the Washington Post. I read a lot of fiction and nonfiction, but this one was specifically about us, right? And so I would recommend that everybody get it. I think it gives a very clear understanding of the trials and tribulations that we're dealing with in the oral health community today.
And it's just called Teeth.
Yes, Teeth by Mary Otto. Yep.
All right, awesome. What's been the most helpful non-oral surgery thing that you do in your life that can potentially help you with your daily oral surgery skills?
Yeah, I think that this is like such a common thread from all the surgeons that you ask for, and it's taking care of your body. It's working out and eating well. It's something that I tell my residents about. They have such terrible habits when it comes to like ergonomics and leaning over the patient. They're not positioning the patient correctly. But just like, be aware that your body is a temple, and especially for people like us, like, we got to take care of it, because if you want a long career, you're going to have to be able to do this really physically daunting task for a long time. And there's just already so many people that I know that are friends or friends of friends that aren't able to practice anymore, or have to change their scope of practice because of difficulties with their health. So please, please, please take care of your health. And this is something that I learned from my family. My family is a lot of physicians, a lot of dentists, and we all kind of like share all of like our new health tips. Like most recently, I got on the blood glucose monitors, and like I'm always trying to find out what the next edge is for improving my health. But it's only a recent thing. It's only something that I've done since I've entered my 40s, and I see all of the changes that are happening as I get older. So for everybody out, time is going to hit you. So try your best to make sure that it's a healthy body that you're using every day.
Love that. Yes, I definitely felt the time hit me when I hit my 40s, so I can agree with that one.
It's funny, like you just wake up and there's just new pains that like, oh, like I didn't even know I had a body part there, but that's hurting now,
Yeah, exactly. Before I hurt myself like trying to do a reverse, jam in a basketball game, and now I hurt myself just sleeping the wrong way. It's so stupid.
Yeah. Exactly.
All right. What forceps do you use to extract tooth number 14?
Oh my gosh. So, I'm a big sectioner. We have these like electronic hand pieces. I use like a really thin burr, a 701, and I just like to first, obviously, try my best to elevate it and elevate. Try a forcep. Most often, if it doesn't come out by itself, I'm sectioning and using periotomes to extract the roots individually.
Some of those maxillary molars can be the most difficult teeth, especially if they're root canal treated, and maybe you got a patient who can't lean back very far, and you're cranking your neck, just you can't even see what's going on.
Yeah, I know. If it doesn't come out very easily in the first few minutes, I'm grabbing my handpiece because it's so predictable to cut it into pieces and get it out.
For sure. All right. How about what's the best movie you've seen in the past year, or TV series?
F1. If you haven't seen it, go see
Yeah.
it. I'm not even an F1 fan, but like the idea of a collaborative team effort to have a better outcome is something that's applicable to any situation. It's something that when I saw that movie, I came and I was telling my staff, listen, I need a few minutes from you, a few minutes from you, a few minutes from you, and we're going to be able to do the surgery within a few hours, which is a line directly out of F1. So not only was it really fun to watch, exciting, I would really recommend you go see it in the big screen, but it was so applicable to surgery because we're always looking to be faster, be better. And that's something that idea of performance was really highlighted in that movie really well.
Oh yeah, totally loved it. Yeah, and I love the concept of working as a team and team members like potentially sacrificing for other team members to do well, and how having the overall benefit of the team being the goal, not your individual success on that team. That they were kind of pitting Brad Pitt against the younger racer, and how they had those different goals, and then ultimately they work together to achieve something great. So anyhow.
I'm a big movie guy, and I can tell you over the course of the last year, that one was really stuck out to me.
Oh, same here. Have you seen Freakier Friday?
No, I haven't seen that one yet. Is that, would you recommend? Is that a good one?
Oh yeah, I thought it was great. I'm a sucker for those comedy type movies, and it was good.
Have you seen The Naked Gun yet?
No, I haven't. Was that good?
Hilarious, very good, very good. I don't know if you remember the old ones, but
Yeah,
they even those still hold up very well. But this one specifically, like the reboot, comedy movies are so difficult to find these days that are really have a broad appeal. Usually, like they're like Freakier Fridays for like a really specific demographic, but this one, I feel like everybody can enjoy.
Awesome. Favorite quote? Do you have a favorite quote or mantra that you go back to?
Yeah, a rising tide lifts all boats. The idea of a broad-based change making the world better for everybody, I think, is something that I always think about. It's something that I see in my own practice. Thankfully we're at 14 different offices now, and if I institute something that affects everybody and it leads to the better, then everybody just feels better.
Yes, so true. Yeah, and even just having a positive attitude and being excited about work, and that rubs off on your team. For sure.
Absolutely.
Last question. You mentioned you have kids. What is your number one parenting tip?
Oh man, that's like I always tell my wife all the time, I'm gonna be a mediocre dad, but a hell of a granddad. So like I think especially for OMFS, we have such if you're taking call and doing like all this stuff, it can get very busy very quickly. And I would say that I read a study that 20 minutes a day of just focused time with each kid individually is really important. And I try to do that in my own life. Aside from that, something that I would tell the world at large is breastfeed. That's something that, many people have said, if you can get the first 5 years correct, then you're good after that. But really those first 2 years, giving them lots of fats to make the brain in such a way that it's really healthy, giving them lots of nutrition so that they can achieve every milestone that they're meant to achieve within those first 2 years, I think is super important also. We should be talking about that in our community as well.
Oh yeah, love that. Love the tip on individual time with your kids, and taking time to talk to them separately. But that's definitely a big one when you have a bigger family. I've mentioned I have 6 kids, and so it takes some work to do individual time when you have that many kids. But so important. And even like just taking advantage of small things. Let's say you're running a kid to basketball practice, and it's just you and that child talking to them. How's your day? What's going on? What things are bothering you or worrying you in your life? Like all those things are special, and I think make a difference.
Yeah, kudos to you for having 6 kids. I have 2 right now, and I really respect all of the responsibility and the contributions to the future. Each one of those kids is going to be a gift to the future, and so I people that have big families, I just really have a lot of respect for.
Oh yes, for sure. And good for you for being a parent and sharing some of your skills with us. I appreciate you. Well, if you're good with it, I'll put your contact info in the show notes and some of the research things you've mentioned. So hopefully our listeners can reach out to you or to myself, and we can continue the conversation on systemic health and the link to oral health.
Absolutely. I would love to talk more for anybody that's listening or collaborate with research. And again, thank you so much for everything that you're doing. I think that this is a really important podcast, and I really value the time that it's taken to create it. I have a few podcasts myself. I know it's not easy. So kudos to you, man.
Thank you, Imran. I appreciate you. It's been fun talking to you. I can tell you're an awesome person. So thanks for doing that.
No problem. Thank you, Grant. You're an awesome person too. Have a great day, everybody.
Talk to you later. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstuckey@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and I've been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.